You might actually be surprised to learn this, but marijuana exposure, it's the most common illicit drug thing reported in dogs and cats.
Yeah, pretty wild, isn't it?
Totally. And it's exactly what we're going to unpack today on the deep dive.
That's right. We're diving into marijuana toxicosis in, our companion animals. We've been looking through excerpts from a really helpful veterinary guide to marijuana toxicosis in pets.
Yep. And our goal is pretty simple, really. We want to pull out the absolutely crucial info for you, the listener.
So you can understand the risks, spot the signs.
And know what to do if you think your pet got into some. And just to be clear, this isn't about, fear-mongering.
No, definitely not.
It's about being informed, prepared.
Yeah.
Being a proactive owner.
Exactly. And the main player here is THC. That's delta-9 tetrahydrocannabinol for the technically minded.
Right, the psychoactive stuff.
That's the one. It's most concentrated in the leaves and buds. And one really important thing, dried marijuana is way more potent than fresh. Definitely something to keep in mind.
Okay, so let's get into the basics then. How exactly does THC affect our pets? What's it doing in their bodies?
Well, it's pretty similar to humans, actually. THC latches onto these specific spots called cannabinoid receptors.
Okay.
There are CB1 receptors, mostly in the brain and spinal cord, the central nervous system. And then CB2 receptors, which are more out in the rest of the body, the peripheral nerves. This binding action is what kicks off all the clinical signs we see.
The guide mentions this minimum lethal dose for dogs over 3 grams per kilogram.
Mm-hmm.
That sounds like a lot. Is that a realistic worry?
It does sound huge, yeah. But, while that's the technical lethal dose found in studies, you really have to see it in context.
Right.
The actual amount of THC in marijuana varies incredibly. I mean, it can be less than 1% or up to 20%, even higher sometimes.
Wow, that's a massive range.
Exactly. So while, it might take a ton of low-potency plant to hit that lethal number, even a small bit of a concentrated edible or something, that can cause really serious problems.
Okay, that makes a lot more sense. So if a pet does get into it, what parts of their body are usually affected? What systems are we talking about?
We see effects across quite a few key areas. The cardiovascular system, heart, blood vessels,
Okay.
the GI tract, so, stomach upset, vomiting, the nervous system is a big one, brain, coordination.
Right.
Their eyes, definitely. And sometimes the respiratory system and even kidneys and the urinary tract can be involved, so it's pretty widespread.
Are some pets, more likely to get into trouble with this than others?
The guide does point out that younger animals pop up more often in these cases.
Okay, yeah, I can see that. Puppies, kittens.
Exactly. It probably just comes down to that natural curiosity, exploring with their mouths, eating stuff they shouldn't. Older pets might be a bit pickier.
Totally rings true. What about the home environment? Are there situations that increase the risk?
Oh, absolutely. Pets in homes where recreational or medical marijuana is used, they're at a much higher risk.
Seems obvious, but good to state clearly.
It really just highlights how crucial safe storage is, really keeping that stuff locked away.
And it's not just the plant anymore, right? You mentioned these medibles earlier.
Yeah, exactly, yeah. Ingesting the plant itself is still most common, but we are seeing more and more cases with these edible products, things with concentrated marijuana baked in.
Like brownies and cookies?
Brownies, cookies, gummy candies, but also drinks, pizza, believe it or not, ice cream, caramel corn chocolates, bread, snack mixes.
Wow, pizza. That list really shows how easy it could happen. Things that smell good to them.
Right. They're often really appealing to pets. Smell, taste. It's a big concern.
And the guide mentions something interesting. A possible link between areas with dispensaries and more pet exposures.
Yeah, that's a really interesting point they brought up. It kind of suggests that where there's more availability, there might unfortunately be more accidental ingestions by pets. It definitely raises questions about, public awareness and making sure people store things safely in those areas.
And then there was that surprising bit about police dogs. Why are they at higher risk?
It's mostly just the nature of their work, really.
Okay.
Police dogs, especially the ones trained for drug detection, well, they might accidentally encounter marijuana during a search. And if it's a dog that tends to just gobble up anything it finds, yeah, the risk is higher. That's why sometimes muzzling is recommended for those dogs in certain situations, for safety.
Okay, right. So let's say, worst case, we think our pet might have gotten into some marijuana. What are the actual signs, the red flags we should look out for?
Well, the signs usually show up within, say, 1 to 2 hours after they eat it.
Okay.
But if they inhale smoke, it can be much faster, sometimes just minutes.
Faster. Okay. And what are those classic signs?
The most common things you'll see are ataxia, that's like lack of coordination. They'll look wobbly, unsteady.
Okay.
You might see hypersalivation, excessive drooling. Vomiting is common too. Their eyes might look kind of glazed over, and the pupils could be really wide, dilated. We call that mydriosis.
Glazed eyes, wide pupils.
Got it. Often they seem really quiet, depressed, maybe lethargic. You might also notice they feel cold hypothermia, or they could be trembling, and sometimes urinary incontinence, just leaking urine. So yeah, that mix of sort of neurological stuff and behavioral changes, that should definitely make you suspicious.
Those all sound pretty concerning. Are there even more serious signs if they got a larger dose?
Yes, definitely. With higher doses, we can see more severe effects on the heart and circulation. Things like bradycardia, that's a really slow heart rate.
Okay.
And hypotension, which is low blood pressure. In, really bad cases, coma can happen.
Wow.
There are also some less common signs, but still serious. Nystagmus, that's where the eyes move back and forth rapidly. Strained vocalizing, maybe a really fast heart rate instead of slow sinus tachycardia. Seizures can happen, though less common. And even hyperthermia, high body temperature. Those definitely mean get to a vet, like immediately.
This is all super important to know. Okay, so we suspect it's marijuana. How do vets figure it out for sure? Is there a test?
Diagnosis. Yeah, it can be a little tricky, actually, because your standard blood tests and urine tests, they don't usually show specific changes that scream marijuana.
Oh, okay.
But those tests are still really important. They help rule out other things that could be causing similar signs, make sure it's not something else going on.
Right, rule out other possibilities. What about those human drug tests you can buy? Can we use those on pets?
That's a really common question, yeah. And the guide mentions this specifically. Generally, those human urine drug tests, not very reliable for pets. They often give false negatives.
So a negative doesn't mean much.
Pretty much. Now, interestingly, if a human test does come back positive on a pet's urine, that's more likely to be a true positive. But still, it's not the go-to diagnostic method.
Okay, not reliable. So what is the best way to confirm it then?
The most definitive way is to send samples, usually stomach contents, if possible, or urine off to a specialized veterinary diagnostic lab. They can test specifically for THC metabolites.
Gotcha. Specialized lab tests. What about x-rays? Would imaging help?
X-rays of the belly, abdominal radiographs, they aren't really for diagnosing the marijuana poisoning itself.
Okay.
But they can be super helpful if the vet is worried the pet also swallowed, like the plastic wrapper, or a big chunk of an edible that could cause a blockage.
Ah, so looking for secondary problems like an obstruction.
Exactly.
You mentioned ruling out other things. What else could look like marijuana toxicosis? What's on that differential list?
Yeah, this is crucial. The guide lists quite a few possibilities. You have to think about other drugs, LSD, PCP, hallucinogenic mushrooms. They can all cause weird neurological signs.
Right.
Opioids are important to consider. They usually cause sedation, slowed breathing, and typically pinpoint pupils miosis, which is the opposite of marijuana. And importantly, there's an antidote, naloxone, that can reverse opioid effects.
Okay, that's a key difference. What else?
Benzodiazepines, muscle relaxants, those can cause sedation, wobbliness. Then there are toxins like ethanol, alcohol, ethylene glycol antifreeze, which is really nasty, causes kidney damage. You might see crystals in the urine.
Antifreeze, right. Very serious.
Methanol, diethylene glycol, propylene glycol, other alcohols and glycols, certain tranquilizers, other depressants. And even xylitol, the artificial sweetener that's super toxic to dogs, causes a big drop in blood sugar.
Wow, that is quite a list. Really shows why you need a vet to sort it out.
Absolutely. Professional diagnosis is key.
Okay, so let's say the vet confirms it, marijuana toxicosis. What's the treatment plan look like?
It really, really depends on how bad the signs are. For pets that are just mildly affected, maybe just a bit wobbly or sleepy, sometimes the best thing is just supportive care in a quiet, low-stimulus environment, like a calm, dim, safe space where they can rest and just ride it out under observation.
So keeping them calm and safe while it wears off, basically.
Kind of, yeah, but with careful veterinary monitoring, obviously, checking their vitals, making sure they're okay.
Right. What about more serious cases?
For more significant cases, treatment usually focuses on two things: decontamination, trying to get the THC out,
Okay.
and supportive care to manage the symptoms they're having.
How do you do the decontamination part?
Well, if the pet ate it very recently, like within maybe 2 hours, and they aren't showing major signs yet or already vomiting, the vet might induce emesis. Make them vomit to get some of it out before it's absorbed.
Okay. What if it's been longer, or they're already pretty sick?
Yeah, in those cases, or if they ate a huge amount or something really concentrated like pot butter or a strong edible, inducing vomiting might not be safe or helpful. Gastric lavage might be an option then.
Gastric lavage.
Hmm.
Stomach pumping.
Essentially, yeah.
Yeah.
Washing out the stomach. We also often use activated charcoal.
Oh, yeah, I've heard of that for poisoning.
Exactly. It helps bind toxins in the gut, stops them from getting into the bloodstream. The vet might give that multiple times, maybe every 8 hours for a couple of doses, especially if the signs are bad.
Makes sense. And what about the supportive care? What does that involve?
It's really tailored to what that specific pet needs. Could be warming them up if their temperature is low,
Right.
or cooling them down if they happen to get a fever, though low temp is more common. 4V fluids are often really important, especially if they're dehydrated or have low blood pressure.
Okay, please.
If they're having trouble breathing, they might need oxygen therapy. And for pets that are really out of it, like comatose,
Yeah.
that requires intensive nursing. Things like putting lubricant in their eyes so they don't dry out and turning them regularly to prevent pressure sores.
Okay, very comprehensive care. Are there specific meds vets use to counteract the THC itself, like an antidote?
Unfortunately, there isn't a specific antidote for THC in pets, not like naloxone for opioids, but we definitely use medications to manage the symptoms. Antiemetics, anti-vomiting drugs like meropitant are commonly used. The guide gives specific doses for dogs and cats.
Right, control the vomiting.
And if the pet is really agitated, anxious, maybe showing that CNS stimulation, diazepam can help calm them down. Again, specific doses are important.
Okay. Are there any drugs vets usually try to avoid in these situations?
Yes, that's a really good point. Acepromazine, which is a common sedative,
Huh?
should be used really cautiously, or maybe not at all. It can actually make low blood pressure worse, which is already a risk with marijuana.
Okay, avoid ACE. Anything else?
Phenobarbital, another sedative, is also generally avoided. It can just add too much sedation and increase the risk of respiratory depression, slowing down their breathing too much.
Got it. So, okay, the pet's getting treatment, starting to feel better. What happens next? What's follow-up like?
Close monitoring is still key during recovery. The vet team will typically keep checking their temperature, heart rate, breathing rate, usually every couple of hours until everything's back to normal. Okay. And if low blood pressure was a problem, they'll keep a very close eye on that too.
And then looking long-term prevention. What's the best advice for pet owners?
Pet owner education is it's everything, really.
Yeah.
It's so important people understand the risks of leaving marijuana or any food with it where pets can get it. We have to remember, pets explore with their noses and mouths, and they will absolutely eat this stuff if they find it.
So practical tips.
Keep everything plants, edibles, whatever, securely stored. Ideally, like child-proof containers, locked cabinets, high shelves, out of reach.
Makes sense.
Be extra careful during parties or gatherings where things might be out. And like we mentioned for those police dogs, if you have a dog that just eats everything, maybe a muzzle is appropriate in certain situations where exposure might happen.
Right. Okay, so just to kind of wrap up the main points, THC hits the nervous system. Signs range from wobbliness and drooling to serious heart issues. Prompt vet care is absolutely critical if you suspect anything.
Exactly.
And prevention, keeping things secure, is the absolute best strategy.
You got it. Being informed about the risks, taking those simple steps to prevent access, that's the best way to keep your pets safe and sound.
This has been incredibly informative. Really drives home how careful we need to be, especially, as marijuana becomes more common legally in many places.
Yeah, it's an evolving landscape.
It really makes you wonder, as these products get even more widespread, what sort of new challenges, maybe unexpected ones, are we going to face? For pet owners, for vets,
Yeah.
trying to keep our animals safe, definitely something to think about. Thanks so much for digging into this with us today.